Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
If you are preparing for GPAT Niper DI Pharmacist exams, then this video is going to be very useful, knowledge oriented and helpful for your preparation. So it's my request to you, please watch the complete video. In this session, we are going to see knowledge booster dose part 18. That means we have already seen 17 videos on knowledge booster dose. So if anybody has not seen those videos, please go in the playlist of our channel and watch those videos also. Now in this video we are going to see one-liner questions, their answers with added explanation part 3. That means we have already seen two parts of one-liner questions and their answers. So again it's my request to you, please watch this video until end. So first question of today's session. Chlorine Pinnacle causes which syndrome? So basically they are asking about the adverse reaction of chlorine pinnacle, one of the adverse reaction. So जैसे ही आपको ये chlorine pinnacle का और syndrome के बारे में पूछा है तो आपको फटक से याद आना चाहिए कि it causes grey baby syndrome. Chlorine pinnacle causes grey baby syndrome in the childrens. Chlorine pinnacle क्या करता है? Grey baby syndrome करता है. और grey baby syndrome मतलब क्या है? Chlorine pinnacle is metabolized in the liver and your babies they have insufficient metabolizing capacity up to the drug. जो ड्रग का मेटाबॉलाइजिंग कैपेसिटी होता है बच्चों में वो कम होता है और उसकी वजह से उनको सीवियर हाइपोटेंशन होता है, उनका ब्लड सप्लाई प्रॉपर नहीं होता एंड ड्यू टू दैट deficiency of blood supply to the tissue and all that, so baby will develop a gray color and that syndrome is known as a gray baby syndrome. Lot of other symptoms are there. If you want to read, you can read from books. So that is a gray baby syndrome caused by chlorine pinnacle. Now what is chlorine pinnacle? Chlorine pinnacle is nothing but the antibacterial drug. It is a broad spectrum antibacterial drug. Originally it was obtained from Streptomyces venezuelae. Now it is semi-synthesized. Remember the source also, again very important, and remember the mechanism of action. What is the mechanism? Inhibit the protein synthesis of bacteria by binding to a 50S ribosomal subunit. ये 50S ribosomal subunit को बैक्टीरिया की बाइंड करता है एंड प्रोटीन सिंथेसिस को इनहिबिट करता है एंड मोर स्पेसिफिकली इट इनहिबिट द एंजाइम नोन एज अ dipeptidyl transferase, the enzyme responsible for the elongation of your peptide bond in the apparatus, protein synthesis machinery. So remember, again in addition to that, this chlorine pinnacle causes aplastic anemia, then a lot of other adverse reactions are also there. So remember, now second question, that is question number 42. ACE inhibitors main side effect. What is the main side effect of angiotensin converting enzyme inhibitors? So basically you should know ACE inhibitors, these are the nothing but the drug used in the treatment of hypertension. They inhibit the formation of angiotensin second. Okay, what is ACE? Basically you should know what is ACE, angiotensin converting enzyme. So it is a proteolytic enzyme responsible for the metabolism of different proteins, so like your histamine, bradykinin, etc, etc. So as there is inhibition of this enzyme by ACE inhibitors like prils, enalapril, posinopril, lisinopril, ramipril, perindopril, etc. So these drugs inhibit this enzyme. So what happens? The consequences of that inhibition leads to increase in the bradykinin level of your body, and the bradykinin level increase the bradykinin will act on bronchial smooth muscle. So it causes the persistent dry cough. So इसके ऊपर question already आ चुके हैं. So you should know the main adverse effect of ACE inhibitors. That is nothing but the cough and angioedema. So more specifically, persistent dry cough and angioedema. So they are used in the treatment of hypertension. Remember. Now we'll see next question. Drug causing pseudomembranous colitis. So which drug causes the pseudomembranous colitis? तो ये pseudomembranous colitis होता क्या है? It is an inflammation of your GIT. Inflammation of your GIT. So drug causing pseudomembranous colitis. The answer is nothing but the clindamycin. Clindamycin. The adverse effect of clindamycin is nothing but the pseudomembranous colitis. ये clindamycin जो है ये pseudomembranous colitis करता है. इसका एक one of the adverse effect होता है. Again, this clindamycin is used in the treatment of acne vulgaris. जो आपके मुंह के ऊपर फोड़े वगैरह आते हैं. So that is acne and vulgaris. So it is a drug of choice in treatment of acne and vulgaris. Clindamycin. Okay, remember. Now next question. Vitamin causing hyperglycemia. So Basically, there are two vitamins, uh, vitamin A and vitamin B6, niacin. So particularly this niacin or nicotinic acid, it causes the hyperglycemia. Now ये hyperglycemia मतलब increased sugar level of body. ये कैसे करता है? It interfere with the glucose metabolism and also interfere with the insulin metabolism and secretion. So by interfering with the insulin and glucose metabolism, it increases the hyperglycemia, right? Next question. Name the drug causing systemic lupus erythematosus like syndrome. तो देखो यहाँ पे कौन से ड्रग ऐसे कि जो सिस्टमेटिक ल्यूपस इरिथ्रेमेटस सिंड्रोम करते हैं. सो बेसिकली यू शुड नो व्हाट यू मीन बाय सिस्टमिक ल्यूपस इरिथ्रेमेटस. ये होता क्या है? इट इज ऑटो इम्यूनो डिसीज और डिसऑर्डर. ओके, इट इज ऑटो इम्यूनो डिसीज वेयर योर बॉडीज ओन सेल kills your cells. So there is an inflammatory, it is an inflammatory reaction, autoimmune hota hai wo, and that is because of the few drugs like sulfa drugs, then hydrolazine, isoniazid, procainamide, phenytoin. So lot of drugs, they have adverse effect of this systemic lupus erythematosus. तो आपको याद रखना है इसको. Next question we'll see. Tardive dyskinesia is the side effect of. So it is the side effect of your antipsychotic drugs, particularly typical antipsychotic drugs. So basically tardive dyskinesia होता क्या है? Tardive dyskinesia मतलब symptoms of your Parkinsonism. तो Parkinsonism किसका एडवर्स इफेक्ट है या फिर tardive dyskinesia किसका एडवर्स इफेक्ट है? सो जो टिपिकल एंटीसाइकोटिक होते हैं या फिर जो फर्स्ट जनरेशन एंटीसाइकोटिक होते हैं, जैसे आपका हेलोपेरिडोल हो गया, आपका क्लोरप्रोमेजिन हो गया, क्लोरप्रोमेजिन, हेलोपेरिडोल. सो most of the typical antipsychotic drugs, they have tardive dyskinesia as an adverse effect. Remember, क्वेश्चन बहुत बार आ चुके हैं, सभी क्वेश्चन आ चुके हैं. सो नेम द एंटी ट्यूबरकुलर ट्रीटमेंट ड्रग यूज्ड इन द ट्यूबरकुलोसिस व्हिच इज अ साइटोक्रोम P450 inducer. सो याद रखो, rifampin is the antibiotic which is a potent enzyme inducer and it is a first line drug used in the treatment of tuberculosis. Okay, tuberculosis is caused by Mycobacterium tuberculosis, which is known as the acid fast bacilli. Remember, and a patient suffering from HIV or patient suffering from AIDS, definitely the patient gets secondary infection of tuberculosis. तो जो HIV का पेशेंट होता है या एड्स का पेशेंट होता है, वो एड्स की वजह से नहीं मरता, वो मरता है ट्यूबरकुलोसिस की वजह से. बिकॉज एड्स में क्या होता है कि पेशेंट का इम्यूनिटी खराब होता है, CD4 सेल डिक्रीज होता है, काउंट कम होता है, तो इम्यूनिटी खराब होता है, इसलिए पेशेंट वनरेबल बन जाता है किसको? secondary infections. And one of the most common secondary infection after AIDS is nothing but the tuberculosis. So patient dies because of the tuberculosis, not by AIDS. Okay, remember, rifampin is the potent enzyme inducer. Remember. Now we'll see next, antidote for warfarin toxicity. So warfarin क्या है? Warfarin is an anticoagulant. So warfarin is an anticoagulant and it acts by inhibiting the synthesis of blood clotting factors which are vitamin K dependent. सो वारफेरिन क्या करता है? विटामिन के डिपेंडेंट ब्लड फैक्टर जो है उसको इनहिबिट करता है, तो ब्लड क्लॉटिंग कम हो जाता है. सो इट इज अ एंटी कोआगुलेंट. ओके, सो कोआगुलेशन प्रिवेंट करेगा. एंटीडोट फॉर वारफेरिन टॉक्सिसिटी इज ऑब्वियसली विटामिन के. सो विटामिन के इज यूज्ड एज एंटीडोट फॉर वारफेरिन टॉक्सिसिटी. क्वेश्चन नंबर 49, साइड इफेक्ट ऑफ आइसोनियाजाइड. ये सिंपल क्वेश्चन है, बहुत बार क्वेश्चन पूछा है. सो आइसोनियाजाइड इज अगेन अ फर्स्ट लाइन एजेंट यूज्ड इन द ट्यूबरकुलोसिस. आइसोनिकोटिनिक एसिड हाइड्राजाइड, दैट इज आइसोनियाजाइड. So the adverse effect of this drug is a neuropathy. Okay, it causes the peripheral neuropathy. So adverse effect क्या होगा इसका? Neurotoxicity and hypertoxicity. So most commonly it causes peripheral neuropathy, and peripheral neuropathy is there because of the isoniazid. Then you can treat that peripheral neuropathy by vitamin B6 pyridoxine. So pyridoxine देके you can decrease the toxicity of. Remember, the toxicity of isoniazid can be decreased. Peripheral neuropathy caused by, remember, you can decrease the peripheral neuropathy caused by isoniazid by giving vitamin B6, that is known as a pyridoxine. So that's why to prevent the peripheral neuropathy caused by isoniazid, it is the patient of tuberculosis is already given this vitamin B6. So isoniazid का इफेक्ट होता है न्यूरोटॉक्सिटी एंड हाइपरटॉक्सिटी. Question number 50, drug which decreases the triglycerides. ट्राइग्लिसराइड बॉडी के लेवल कौन कम करता है? सो इट इज अ obviously anti-hyperlipidemic drug. The answer of this question is nothing but the clopidogrel, fibric acid derivatives. So fibrates are nothing but the fibric acid derivative, and they inhibit one enzyme known as a, they are agonist to the lipoprotein lipase. So fibric acid derivatives, clofibrate, gemofibril, etc. So they are known as a lipoprotein lipase agonist. ओके सो ये क्या करेंगे, उसका एक्टिविटी बढ़ा देंगे एंड इट विल ब्रेक डाउन द लिपोप्रोटीन्स. It will decrease the triglyceride levels and it will decrease the triglyceride levels because it causes the breakdown of very low density lipoprotein. So that's why fibric acid derivative or clofibrate, gemofibril, they causes the decrease in the triglyceride level of your body. Okay, used in the obesity. Question number 51, drug protective against the diabetic nephropathy. So actually they are asking about the antihypertensive drug which are used to protect the diabetic nephropathy. ACE inhibitors are the drug. They are the only drugs available for the treatment of hypertension in the diabetic neuropathy. Diabetic patient में ACE inhibitors ही use कर सकते हैं, दूसरे नहीं use कर सकते because of the diabetic nephropathy. Okay. Now next question, drug which causes the cyanide toxicity. तो cyanide toxicity करने वाले कौन से ड्रग है? तो जिसमें भी साइनाइड ग्रुप होगा वो साइनाइड का टॉक्सिसिटी करेंगे. फॉर एग्जांपल नाइट्रोप्रोसाइड. सो दिस ड्रग कैन कॉज द साइनाइड टॉक्सिसिटी. नाइट्रोप्रोसाइड कैन कॉज द साइनाइड टॉक्सिसिटी. तो यहाँ पे आपको साइनाइड टॉक्सिसिटी हो गया तो उसका एंटीडोट मालूम होना चाहिए. तो व्हाट आर द एंटीडोट फॉर साइनाइड पॉइजनिंग? सो अमाइल नाइट्रेट इज यूज्ड, सोडियम नाइट्रोप्रोसाइड इज यूज्ड, देन सोडियम नाइट्राइल इज यूज्ड. सोडियम नाइट्राइल, sodium thiosulfate, amyl nitrile. These are the specific antidote for cyanide poisoning. In addition to that, आपको ऑक्सीजन का सपोर्ट मिलेगा. तो यहाँ पे याद रखो सोडियम थायोसल्फेट, amyl nitrate and sodium nitrite. Sodium nitrite, amyl nitrate and sodium thiosulfate. These are the antidote for cyanide. Now we'll see the next question, that is the hydrolyzin decreases. तो पहले तो क्या है कि हाइड्रोलाइजिन डिक्रीज करता है. क्या तो हाइड्रोलाइजिन क्या है? इट इज नथिंग बट द आर्टेरियोलर डायलेशन. आर्टरीज को आपको डायलेट करेगा. एंड ड्रग यूज्ड इन द ट्रीटमेंट ऑफ एंजाइना पेक्टोरिस. सो इट डिक्रीजेस द प्रीलोड एंड आफ्टर लोड. रिमेंबर हाइड्रोलाइजिन डिक्रीज द प्रीलोड एंड आफ्टर लोड. वर्कलोड कम करेगा हार्ट के ऊपर का. देन एक्शन ऑफ ग्लिटाजोन, पायोग्लिटाजोन, रोसिग्लिटाजोन, all these are nothing but the drug used in the treatment of diabetes. So what is the action of glitazones? So they increases the insulin sensitivity in the peripheral tissue. So they increases the insulin sensitivity in the peripheral tissue. इसमें यूज करेंगे नॉन इंसुलिन डिपेंडेंट डायबिटीज मेलिटस. नॉन इंसुलिन डिपेंडेंट डायबिटीज मेलिटस. तो इसमें क्या होता है कि इंसुलिन होता है लेकिन उसका सेंसिटिविटी कम होता है. सो ये जो ग्लिटाजोन्स है दे इंक्रीज द पेरिफेरल यूटिलाइजेशन ऑफ ग्लूकोज बाय increasing the sensitivity to the peripheral tissue, sensitivity of insulin to the peripheral tissue. Now next, sulfonyl urease closes which channels in the beta cells? तो ये important question है आपको. ये actually this is a question from classification. So remember sulfonyl urease, they are known as a KTP channel blockers, potassium gated ATP channel blockers. So KTP. Sulfonyl urease, they are a KTP channel blocker. Okay, remember they are used in the treatment of diabetes. Sulfonyl urease. Now first line therapy for diabetes type 2 diabetes mellitus. So first line therapy for diabetes mellitus obviously sulfonyl urease. So one of these drug is nothing but the metformin. Metformin is a first line therapy of type 2 diabetes mellitus. Now next question, which drug is a teratogen? Teratogen means what? So if a drug when taken by a pregnant woman is able to cause any malformation in the child और फीटस, देन इट इज नोन एज अ टेराटोजन. सो बहुत सारे ड्रग होते हैं टेराटोजेनिक इन नेचर होते हैं. फॉर एग्जांपल कार्बामेजोल, मिथामेजोल, प्रोपाइल थायोरेसिल, बाद में आपका कार्बामेजेपिन होता है, थैलिडोमाइड होता है, फिनिटोइन, थैलिडोमाइड, कार्बामेजेपिन, ऑल दीज आर नोन एज टेराटोजेनिक ड्रग. ओके, सो नेक्स्ट क्वेश्चन इज नथिंग बट द ड्रग यूज्ड इन द सिंड्रोम inappropriate antidiuretic hormone secretion. Drug used in the syndrome inappropriate antidiuretic hormone secretion. Inappropriate antidiuretic hormone secretion, there is a condition, there is an inappropriate secretion of antidiuretic hormone. So what will happen? So if there is a increased secretion of antidiuretic hormone, so there is a water sodium retention in the body. So in that case you have to increase the urine formation. So drug used in the syndrome inappropriate antidiuretic hormone, that is nothing but the democycline. That is, there are two drugs. First one is the democycline and second one is the lithium. So both of these drugs, they causes the nephropathy. They act on a proximal convoluted tubule and they increases the they prevent the reabsorption of sodium and water. Okay, they are used in the syndrome inappropriate antidiuretic hormone. Okay, democycline and lithium. So democycline is mostly used. Lithium has a certain adverse effect. So question number 59, mechanism of proton pump inhibitor. So obviously proton pump inhibitors मतलब क्या, proton pump को inhibit करने वाले. So this proton pump is present in your stomach, which is responsible for the generation of hydrochloric acid. So this proton pump finally makes hydrogen ion available. That nascent hydrogen combined with the chloride ion to form a HCl. Now proton pump inhibitors like azoles, all the azoles, omeprazole, pantoprazole, rabeprazole, esomeprazole, dextromethorphan, all these are known as PPIs, proton pump inhibitors. They are used in the gastric ulcer, duodenal ulcer, and they are drug of choice in the Zollinger-Ellison syndrome. Remember, क्वेश्चन आपको आता है इंपॉर्टेंट है. जोलिंसन इलिसन सिंड्रोम में ड्रग ऑफ चॉइस कौन है? प्रोटॉन पंप इनहिबिटर ओमेप्राजोल. दे इरिवर्सिबली इनहिबिट द हाइड्रोजन पोटेशियम एटीपेज pump, hydrogen potassium ATPase pump in the stomach in the parietal cell which secrete the gastric acid. तो यहाँ पे देखो दो चार क्वेश्चन कवर हो चुके हैं. parietal cell will secrete the gastric acid. Okay, gastric HCl. So HCl is secreted in the stomach by parietal cells. Remember. Now this proton pump irreversibly inhibit this. Proton pump inhibitors irreversibly inhibit the hydrogen potassium ATPase in the stomach. They inhibit this proton pump for 24 to 48 hours. Or single capsule of omeprazole will inhibit the acid formation for 24 to 48 hours. Remember, and they are taken on empty stomach. Question number 60. Carcinoid tumor is treated by. Carcinoid tumor is treated by. So carcinoid tumor is nothing but a tumor of variety of organs, but basically they are found in the GIT. The tumors are related to increase in the histamine, bradykinin, vasoactive peptide in the stomach, and that's why a somatostatin analog drug is used, known as a octreotide. Octreotide inhibit the release of that histamine, prostaglandin, serotonin, then vasoactive peptide in the stomach. Okay, that's why octreotide is used in the carcinoid tumor. You can order this magic bullet for GPAT Niper DI Pharmacist. Read twice before exam and qualify 100% with good rank in very short period. You can see we have very much promising results from past few years. You can also join our online crash course for GPAT 2024-25.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify